Hey everyone, Mr. Zentner here, here for a reading assignment. I'm going to try to get through as much as possible, but I have a 5-minute limit on this recording device, so I'll get through as much as I can. Still confused about masks? Here's the science behind how face masks prevent COVID. It's our reading assignment for week 2. Both the Centers for Disease Control, the CDC, and the World Health Organization now say that everyone should wear a mask to protect against the spread of COVID. But earlier in the pandemic, both these groups said the opposite. So, what caused this change? Like in science, more evidence can lead to changing the ideas we had before. In the last year, as the last year has continued, more evidence supports the wearing of masks prevents the spread of COVID, and that the more people wearing masks, the better. Epidemiology is the study of health and diseases and how diseases spread in human populations. We talked to epidemiologist Dr. George Rutherford about the CDC changing their minds on mask wearing, the current science on how masks work, and what to think about when choosing a mask. Rutherford was very clear. People used to be worried that if everyone wore masks, there would not be enough masks left for healthcare workers. Dr. Rutherford was very clear. The worry about masks being left for healthcare workers should not have kept the public from knowing about the benefits of wearing a mask to prevent against COVID. Quote, "We should have told people to wear cloth masks right from the beginning," quote, he said. Even cloth masks make a significant difference, and throughout the pandemic, people in communities have found ways to come together to make, distribute, and provide other masks. According to Dr. Rutherford, another factor in not wearing masks is that the US wasn't really prepared to wear masks because mask wearing is not common in the US except for in medical fields and other trade careers. In many other countries, mask wearing was already more common. For example, in several East Asian countries like China, Japan, and South Korea, wearing masks in public, especially while sick or during flu or cold season, has been common for several generations and is seen as common courtesy to protect others in the community. People tend to get very used to what they see around them in their own culture. So people in the US haven't grown up with masks already part of their everyday lives, and the country wasn't prepared to sell, make, or have other masks available at first. Even now, some Americans are choosing to ignore CDC rules and local rules on masks, a choice that Rutherford says is foolhardy. Well, what may have finally convinced CDC to change its mind is the proof that people could get COVID without showing symptoms or being asymptomatic. Studies have found that people with COVID have the most virus in their bodies days before symptoms begin, and that just talking out loud is enough to give the disease to other people. Quote, "I think the biggest thing with COVID now is that we can't tell who has COVID," end quote, says Rutherford. You can't look into a crowd and say, "Oh, that person has COVID and should wear a mask." A lot of people have COVID and it doesn't show. So everybody has to wear a mask. Next section. What evidence is there that mask wearing is effective in preventing COVID-19? There's a lot of evidence proving that masks work. One type of evidence comes from studying small droplets of liquid and the ability of a mask to block them. An experiment using a high-speed video has found that hundreds of tiny droplets were generated when people speak, but that nearly all these drops were blocked when a mouth and nose were simply covered by a mask. Another study of people who had the flu or cold found that mask wearing lowered the amount of virus found in drops that came out of the nose and mouth. A recent study in Health Affairs compared COVID before and after masks were required in 15 states. It found that mask rules led to the decrease in COVID numbers. Another study looked at COVID deaths in 198 countries and found that those with rules for mask wearing had lower death rates. Two reports also say that masks can prevent COVID in very dangerous places. In one case, a man flew from China to Toronto and then tested positive for COVID. He had a cough and wore a mask on the flight, and all 25 people closest to him on the flight tested negative for COVID. In another case, in late May, two hairstylists in Missouri had come in close contact with 140 people while they were sick with COVID. Everyone wore a mask and none tested positive. Do masks protect the people wearing them or the people around them? I think there is enough evidence to say that the best benefit